Hello, everybody. Andrea here with Dentalelle. So, I have been teaching dental hygiene and dental assisting students how to pass the board exam with a 99.7% success rate, helping students pass for the past 20 years. So, this is an example of our live case study class that we had last Friday. I'm going to go over some questions and answers with you, and we're going to talk about gum disease and special needs. Okay. So, let's go through a couple questions together, case study critical thinking questions. See how you do, and feel free to pause the video at any time if you need to think about the answer a little bit more. But just to kind of work through some with you, let's see how you do, and let's see if maybe you need to study these topics a little bit more. So, question number one here: a 65-year-old, a 65-year-old stroke survivor presents with right side paralysis and difficulty controlling oral secretions. What positioning modification is most appropriate? Would you say A, B, C, or D? So again, feel free to pause the video because I'm going to go over the answer in a moment, but you might need some time to think without hearing me talk. So basically, what I tell all of my students in our live classes is I help you with case studies. I help you with critical thinking and really practicing. So I'm going to kind of zone in and say, okay, look at the key parts of the question here. A 65-year-old stroke survivor has right side paralysis, so not the left side, not the right side. Sorry, not the left side, but it is the right side, and difficulty controlling oral secretion. So that means possibly her saliva. She's having a hard time controlling her saliva where there might be too much. She might be having a hard time swallowing, and perhaps you can't be suctioning every 2 seconds. But what might make her more comfortable? How should you position this patient to help her out? So let's go through the answer now. So, in every class, we go over answers, but also rationales. Okay. So, the correct answer is going to be B. You want to position the patient upright with the head tilted slightly towards the unaffected side because you want the saliva to pool to one side, making it more comfortable for them, but also easier for you to suction. But remember, the patient is number one. So, we need to make the patient comfortable, and if the saliva is pooling to one side, they're not going to feel like they're choking because it's not staying towards the back of the throat, but it's over to one side. Now, a patient quite often thinks that they can choke on their own saliva, and technically you can, but there has to be a lot there. So typically, you should be suctioning, helping the patient out. But just remember, if they're a stroke survivor, they can't feel things the same depending on what side's affected. So in this case, it's the right side. They're going to be a little bit uncomfortable. They can't manage things as best they could before. So these are just kind of the answers here with the rationales. Now, A would not be correct because the head fully back makes it difficult to control secretions. Supine with the chin down isn't going to work because it's very difficult to swallow with your chin down. Try it now. It's even hard for me to talk. So that would be the wrong answer. D, the Trendelenburg position, well, that is just dangerous because it's too high on the one side. It's not comfortable for anybody, and we wouldn't do this in a dental office that way anyway if we're working on a patient during treatment. So let's go through another one. A patient with Down syndrome presents with generalized gingivitis and early periodontal disease. Which oral condition is most strongly associated with Down syndrome? So this is another special needs question. A, B, C, or D? What do you think? And I challenge my students, even as you're going through these questions, kind of study a little bit in a different way too. Think of other things to make sure you understand other parts too. For example, A, increased caries risk. Can you think of special needs clients that would have an increased caries risk and why? What about B, aggressive perio? What clients would have aggressive perio and why? What would that look like? Or as you're thinking about this, do you not remember what aggressive perio is? Stop, go back to your modules or textbook, look it up, and then now you're constantly studying in a different way, relearning something new. C, oral cancer. What do you know about oral cancer? Feel free to make notes. So you're not just answering the questions, you're not just studying the questions, you're looking into other parts and learning something new because there is such a thing as studying too much of the same thing. Then you start to memorize, but you don't really understand it. But if you go through these case studies questions the way I'm teaching you, you're always opening up your mind to something else. Now, the answer is going to be B. So, aggressive perio is strongly associated with Down syndrome clients. Now, A is not the right answer because caries isn't really a problem here. It's more so it's deeper than that. It more has to do with the gums. Their saliva, their tongues are larger typically. They breathe through their mouth a lot. So caries could have something to do with it, but the better answer is still going to be perio. This is directly from your textbook. And if you're a member of the Dentalelle Board Exam Prep Academy, this would be in your special needs module where I go through all of the special needs clients and I tell you what you need to look out for. Now, oral cancer doesn't make a difference here. And rampant erosion, well, that doesn't matter either because rampant erosion is more if there's a chemical aspect to it, like too much acidity in one spot, just as an example. But Down syndrome is so much more than that. And it says here too, your patient has generalized gingivitis and early perio. So if they have generalized gingivitis and early perio, well, which condition could come off of that. Okay. So we're not just talking caries, but more so would be aggressive perio. If their gingivitis and then early perio gets worse, which it quite often can, because a caregiver needs to be in charge quite often of a Down syndrome client, but it can be very difficult to brush in there and do things properly. Now, let's go through another one, but let's go through maybe some gum disease. Okay, let's do this one here. A 65-year-old patient, so they're 65 again, with a history of heavy smoking shows generalized horizontal bone loss. What is the best classification? Would you say A, B, C, or D? And feel free to stop the video if you need to think about it. So the best answer here is going to be C, chronic. So, or sorry, did I? Oh, sorry. Oh my goodness. What did I do here? Sorry, guys. Chronic perio or C, I said, oh yeah, sorry. Sorry, you guys. I was thinking it's supposed to be C, but then I'm like, wait a minute, it's not C. But I looked at it quickly and I'm like, the answer is C, but that's the wrong answer. So sorry. Just forget I said all that. The answer is B. So we're moving on. The answer is B, chronic perio. So why is this? A history of heavy smoking shows generalized bone loss. Generalized bone loss is going to be perio. As soon as you see bone loss, that's perio. As soon as there's a 4 millimeter pocket, that's perio. So we already know it can't be gingivitis. Now, what about aggressive perio? Well, that's not wrong. But in this case, B is the better answer because it doesn't give us more in the question. All it says is a heavy smoker and generalized horizontal bone loss. But just because they have bone loss doesn't mean they have aggressive perio. If it said generalized severe bone loss, that might be different. But it just said generalized horizontal bone loss. So that's why chronic is the better answer. And aggressive perio happens very quickly. Now, this one is saying a history of heavy smoking. So that suggests something of more of a chronic nature. Now, D, it's not gingivitis again. Keyword here, gingivitis, because we're already showing bone loss. So that's how you know it has to be perio. So, how did you guys do with those? Those were some of the easier ones. I'm just kind of scrolling through quick of the case studies that we had here for week 3, where we went over gingivitis and gum disease. Week 4 is actually this Friday, where we're going over what are we going over? Infection control and sterilization. I'll just kind of show you that quickly in case you're curious. I just finished some extra questions today. There we go. So, week 4 this week on Friday, depending on when you're watching the video, of course, it might be different. But infection control and sterilization, we have some really good questions to go over. So, hopefully, you are a member of our Board Exam Prep Academy. You can either sign up for the study guide package, the express package, or the VIP package. 3 separate packages you can pick from. It just depends on the price point, how long you want to be studying for, and what you all need inside. but everybody has full access to our live classes, which is fantastic. I have fun with these live classes because I can talk to you, I can help you offer clarification, and you can ask me as many questions as you like. So I hope you liked this video. Click like, and I would be happy to do more like this. Make sure to subscribe to the Dentalelle channel because there's at least one video a week, usually two or more. It just depends on the week. So thank you guys for watching, and I'll see you in the next one.